Hello, I'm Katie McMahon, Director of Product Management for MedQuist. Thank you and welcome again to RSNA 2010. MedQuist provides the SpeechQ solution, an interactive speech recognition solution that provides improvement for turnaround time, referring and patient satisfaction, and a host of other solutions that will increase productivity and efficiency for your radiology department. Our product is 98% voice-navigable, so you can utilize command and control and hands-free dictation to move through your patient workflow easily and manageably. We integrate with over 20 to 30 of the leading RIS and PACS vendors to again provide the best workflow options which are consistent with how your radiologists work today.
Hello, my name is Brent Catlin. I'm the Radiology Sales Director for MedQuist, and we're here today to talk about SpeechQ for radiology. On the left side are the commands that are available to me as a radiologist dictating. At any point in time, I have the opportunity to finish and sign, suspend any number of reports so that I can come back and complete them later. I can also send a report for editing. I can discard the changes or assign multiple orders, and even do a print if I'd like to dictate a consult or a recommendation letter, for example. So as we see in the center of the screen, SpeechQ for radiology, my cursor is blinking and I can begin dictating. Examination, chest tube views, paragraph, findings, the heart, lungs, bony structures and soft tissues are all within normal limits, period. There is no evidence of pulmonary disease, period, paragraph. Impression, number 1. Normal chest, number 2, no evidence of pulmonary disease. So as you can see, I've developed a report using punctuation, utilizing my workflow that I would normally use, and come up with a report that's ready for signature. Finish and sign. The report is now en route to the RIS for storage and distribution. When I launch my next PACS, it will automatically launch SpeechQ template and provide me with my next report. On the right-hand side, you see the auto text that I can capture. The system allows us to have unlimited numbers of auto text. Let's try doing CT chest abdomen with contrast. We build structured reports utilizing 3 different technologies. We have fields, smart fields, which are those areas we can bring in from the demographic data in the RIS, and also, of course, named fields, which are fields we can immediately navigate to by giving a voice command such as go to prior studies. It selects that and allows me to make a change to that individual location. 4/16/09, 5/17/10, and September 14th, 2010. So as you can see, I didn't need to add extra slashes. The system knows immediately what I'm trying to say and how I'm trying to say it. Let's go back now to the beginning, abdominal pain. This is an example of a field that has default text. The default text, of course, can be changed. Severe lower abdominal pain, next field. Insert 5mm axial images, next field. This is an example of how SpeechQ listens to my commands and allows me to put additional auto text inside of a predetermined auto text format. I can also use the controls on my microphone to bounce down to chest and insert maybe some more normal text. Insert chest 1. What I get then is my chest 1 that comes in to fill in part of my report. I can bounce down to abdomen and pelvis. Insert abdomen and pelvis. This gives me some additional information regarding what I wanted to put in for abdomen and pelvis. People also want to know, can I change some of the information in the auto text if all I want to do is make a minor change? And of course the answer is yes. Select diverticulosis. Select sentence. There is no diverticulosis of the colon, period. We would encourage you to contact your MedQuist representative for a more detailed demonstration, but keeping in mind the 3 strengths of the speech magic engine we use in SpeechQ for radiology. First, it never stops learning. Number 2, it doesn't matter whether the radiologist or the physician makes the change themselves. They also have the opportunity to send to an editor, and when the editor makes the correction, it will automatically update the doctor's voice file, a very important differentiator. And number 3, all work and all recognition is done at the client. It does not have to be transferred over to the server, back to the client, over to the server, and back to the client for recognition.
Thank you for taking a few minutes to learn more about SpeechQ. For more information, please contact us at medquist.com. Thank you.